eye surgery and generally eyes is such a field that it keeps evolving and keeps progressing. It never stands still. So the advantages there are that treatments, technologies, procedures keep improving with time. So we have several innovations that we specifically work on, and we're unique at working with them in the region. Particularly our vision correction procedure that's trademarked called SupraLASIK. Now, what that is basically a non-surgical way of correcting vision. All right, so that's basically in all the problems that would traditionally have been encountered with LASIK, such as dry eye, glare halos at night. The things that really concern people with that procedure have largely been eliminated by the introduction of this technique. We are now several years into it, and we have many years of long-term follow-up data which show that we have one of the highest safety, one of the lowest retreatment rates, and the best predictability of any vision correction procedure out there. In addition to that, we have vision correction that we promote for any age. So what we basically do is that there is no one solution that's going to fit everyone. So you have to have every possible solution and find what's best for each person at that stage in their life and for their requirements. So we actually do go into great detail about the actual requirement of the individual, what's going to work best for their lifestyle and their needs. So for example, if someone's starting to already get problems with near vision and their distance and near are impaired, then the solution changes. Then we move into what we call our premium intraocular lens era. So multifocal lenses, trifocal, and in principle we're the largest user of these premium lens technologies in the region. So we use and have had great experience with giving almost 100% complete freedom from visual aids to people from ages 40 up to even 85. So that's one aspect that works extremely well and has great patient satisfaction. Till date, we've had no situations where we've had to remove a lens or exchange a lens, so I think that shows that we select patients carefully, and then we're very diligent in the whole process, and we generally use a no compromise approach to that. And then other people, in fact including myself, don't fit into either the LASIK category because either the power is too high or they're not ideal candidates, or they don't yet have a reading problem, so they don't need a trifocal or a multifocal or a lens technology. Then we do use a lot of what we call ICL, which is an implantable Collamer lens. And that basically is a technology where a lens, similar to this, is kind of inserted behind the iris, behind the pupil, and basically remains there indefinitely and corrects the vision almost instantaneously. So I know from my own experience, I've had this done a few years ago, and within, I would say, a few hours, my vision was more than 20/20. And that's not changed at all ever since. So that's with a 10-minute procedure. So there's a lot that's come up and a lot that's continuing to come up, and we remain at the forefront of all those technologies.